Hello, everyone, and welcome to International Education Week at UC San Diego. This week, UC San Diego joins hundreds of higher education institutions worldwide to celebrate International Education Week, an opportunity to champion the benefits of international education and exchange worldwide. My name is Rourke Miller, and I'm the director of the International Faculty and Scholars Office and also the Fulbright Scholar Liaison for UC San Diego. The Fulbright program is the US government's flagship international academic exchange program, providing approximately 8,000 awards to students, scholars, and other professionals each year from the US and 160 countries. If you are interested in pursuing a Fulbright Award for your research or teaching interests, check out fulbright.ucsd.edu for information on resources as well as the application process. Additionally, we are recording this session and we will be posting the recording at this site. So as the Fulbright Scholar Liaison for UCSD, I'm so excited for our campus to be hosting this talk by our very first Fulbright Distinguished Chair in the School of Public Health. Our moderator, Professor Michael Pratt, has worked closely with the Fulbright Commission in Brazil to develop a program where the School of Public Health will be hosting a new Fulbright Distinguished Chair for each of the next 5 years from Brazil. So to make this introduction of our inaugural Fulbright Distinguished Chair, I'll turn the show over to Professor Michael Pratt, who is Director of the Institute for Public Health and MPH Program and Interim Assistant Dean for Graduate Education within the Herbert Wertheim School of Public Health and Human Longevity Science. Dr. Pratt.
Thanks much, Mark. And it's a real pleasure to be able to introduce longtime friend and colleague, Professor Pedro Hallal. Professor Hallal is from the Federal University of Pelotas in the south of Brazil, a world-class physical activity epidemiologist. And in the world of the last 2 years, he's also become one of the leading investigators and epidemiologists focused on COVID in Brazil. And so he brings an extremely interesting perspective to us from Brazil on how Brazil has both handled and mishandled COVID, something that is very familiar to us here in the United States as well. And so I'm going to turn it over to Professor Hallal in just a minute for what I think will be a fascinating presentation. If you have questions, please put them into the Q&A, and we'll be monitoring those, and then we will have time at the end of Professor Hallal's presentation for question and answer and discussion. So Pedro, I turn it over to you and really look forward to your presentation today.
So thank you very much, Mike. Thanks, Mark. It is my great pleasure to be here. Thanks, Debbie, for putting this together. You know, it is the end. We are marching towards the end of International Week, and I've been doing talks at the University of Illinois, at the Washington University in St. Louis. But now it is time to give the talk at the University of California in San Diego, which is the organization that's welcoming me for this Fulbright Award. So thank you very much. It is my great pleasure to be here. And I will be talking about COVID in Brazil. And then we have this subtitle, which is the impact of scientific denialism. You know, scientific denialism is a topic that is becoming more and more popular over time for unfortunate reasons. And after you listen to my comments, you will probably agree how important it is for science to deal with denialism over the coming years. So the traditional logo here is the Fulbright logo. So Fulbright is funding my stay in the United States. I'm working as a visiting professor at UCSD. But the logo on the other side is not familiar to many people. It is not the logo of a university. It's not the logos that we are used to see. This is the logo of the Brazilian Senate. You know, the House of politicians, you know, senators. And the reason this logo is here is that a summary version of this talk has been given in the Senate House of Brazil because there was an investigation on the handling and, as Mike said, the mishandling of the pandemic in Brazil. And I was one of the investigators, one of the researchers invited to testify for this commission, providing an epidemiological view on how Brazil is doing in terms of dealing with COVID. So in this talk, the first minutes I will briefly present some methodological issues related to COVID-19 and how we present and how we interpret the data. Then I will spend some time talking about EPI-COVID-19, which is the study. I am the principal investigator, the epidemiological study we are doing in Brazil. And towards the end of the presentation, I will present some mortality data in Brazil versus the rest of the world, particularly focused on COVID-19. So these methodological issues are important to understand what some of the statistics I will present. The first one is that most epidemiologists, we prefer to use statistics on deaths as compared to statistics on cases of COVID-19. And there's nothing morbid here. It's just that we can rely more on data about deaths than we can rely on data about cases. Cases are subject to testing policies, and these testing policies vary a lot from country to country. So if we look at data on cases, pretty much what we see is, just part of the whole story. So this is why we rely mostly on data about mortality. And it's exactly the same reason why we don't like to use case fatality, just to do comparisons across countries or across states in the US or in Brazil. When we compare case fatality, because case fatality obviously depends on the number of cases. And again, the number of cases is not a trustable source. The other thing that I would never say in a talk like this, but I need to say nowadays, is how important it is to use trustable data. Probably the most frequent source of scientific information nowadays in Brazil, I hope it's not the same in the US, but in Brazil, it is WhatsApp. So I get all sources of scientific information in WhatsApp. Some of them are really wrong. And I get in my family group, in my friends group, things like the most recent one, we had a statement from the Brazilian president 3 weeks ago saying that the COVID vaccine would make people develop HIV. But that's true, that happened, and that circulated widely in WhatsApp groups. It took I think 72 hours before YouTube banned that video from YouTube, and then other social media did pretty much the same. But within the first 72 hours, most Brazilians received a video in which the president of the country would say that the COVID vaccine, would lead people to develop AIDS. This is how scientific evidence circulates these days. So it is just important to reinforce how needed it is to reinforce how, that data should come from trustable sources. And the last thing I want to say in this methodological part of the talk, which is very short, is that we should never forget that as scientists, we do not deal with numerators only. We do not deal with these type of things. I'm sorry they are in Portuguese, but the US is the first country in the world in terms of COVID deaths. It is true in absolute numbers, but when you look at relative numbers, the US is not the country with the highest COVID mortality, or Brazil is the fourth in the world in terms of vaccination. It's simply not true. It's just that Brazil has more absolute number of vaccines because Brazil is a big country. In the end, in terms of vaccines, for example, China will be the first in the world if we look at absolute numbers, just because China has many people living in that country. So just to reinforce how important it is to deal with relative numbers and not only with absolute numbers. And the last thing about methods is a statement I get in my WhatsApp, and the sentence goes like this: no matter what you do in terms of responding to COVID, the curves will look the same. I get this all the time. But if you look at data from South Korea and from Portugal, you might think, oh, that's true. So no matter what they do, the shape of the curves will be the same. But as we have learned in Statistics 101, when you look at the graph, you should also look at the scale. So it is true that the shape of the curve is the same in these two countries, but at the top of this curve, South Korea was having 0.4 deaths per 1 million people, and Portugal was having 25 deaths per 1 million people. This makes a huge difference, although the shape of the curve is the same. So, this is Statistics 101, but let's not forget about it, because politicians sometimes just forget about it and they say, no matter what you do, the curve will look the same. Then I move to the second and the main part of this talk, which is the EpiCOVID project. And in order to tell this story, I will go back 40 years ago. In 1981, some colleagues of mine in the south of Brazil, they thought that the statistics, the official statistics on infant mortality were wrong. They had the feeling as pediatricians or as maternal and child health researchers that the information, official information on infant mortality was wrong. It was underestimated. And they developed a study to study that, just to track real life data on infant mortality and to answer the question, what is the real infant mortality rate in the south of Brazil at that time? They conducted a study, and no surprise, they found that infant mortality was much higher than reported in official statistics, because that was early 80s. Official statistics in Brazil were not that good. So that was what they were looking for. But when they went there to run the study, the one thing that the data showed was something else. In addition to the underreporting, and this is a book, classical book for epidemiologists in low and middle income countries, it is called Epidemiology of Inequalities. So the title of this book is inspired by the fact that in the early 80s, my colleagues found that infant mortality in the city of Pelotas, which is a small city in the south of Brazil, it's something like, La Jolla or, Springfield here in Illinois, where I am right now, or in Missouri. So it's a small city, but what they found is that infant mortality among the top 20% families in terms of the income distribution was the same as in some Scandinavian countries, which had the lowest infant mortalities in the world. But within the same city, the infant mortality in the bottom 20% of the income distribution was comparable to some countries in Africa, which had the highest infant mortalities in the world. So at that time, they decided the name of the book should be Epidemiology of Inequality, because, within a single city, they had these massive inequalities going on. So this was 1982 when the study finally took place. Then I will go now to 2020. When we designed this EpiCOVID project, and I will tell you a little bit more about it, the logo of the project is already saying that our research question is like an iceberg. So this logo tries to be like an iceberg and the COVID thing. So pretty much the idea here was that we thought that the official statistics on COVID were wrong. They were an underestimate. and we had to conduct population-based studies, household surveys, to really keep track of the real prevalence of infection at the population level. And it was no surprise to us that when we went there and we conducted the study, we found exactly that. So in the first rounds of the EpiCOVID project, and I will go back to tell you in more detail what these rounds are, the difference between the official statistics and the epidemiological estimates was sixfold, which means that at that time, if you would have, let's say, 1 million cases in Brazil, you could bet that real numbers were 6 million at that time. So that's what EpiCOVID was looking for, and that's what EpiCOVID found. But exactly the same as it happened 40 years ago. And let me just disclosure that 40 years ago, I was a kid. So I was not involved with the study that they conducted at that time. But exactly 40 years ago, they found exactly the same result that we found in 2020, which was we found marked inequalities in COVID infection in Brazil. And I will go into the details of that in a minute. But, you know, the study was designed to do one thing, and we also find something else. So this is, you know, the initial result of the study. So this is a paper we published last year in the Lancet Global Health. You know, it has already almost 200 citations, which is a lot for a very recent paper. And this map here is not only a map with the methods of the study, it also has results. So the blue squares show the cities in Brazil that had a prevalence of antibodies for COVID higher than 10%. The ones in purple had a prevalence of antibodies between 5 and 10. The ones in green had prevalence of antibodies between 2 and 5. And the ones in red had a prevalence of the population with antibodies below 2%. So let me go back to this. This is May 2020, a population-based study countrywide in Brazil, and that was the proportion of the population with antibodies at that time. You know, so the epidemic in Brazil started in the north region, and then it moved towards the northeast, and it was only later the year that the epidemic reached, you know, the Midwest, Southeast, and the south of Brazil. So this is another way to see the same results. So the first round was completed in mid-May. The second round was completed in early June. The third round was completed in late June. So each round incorporates 33,000 interviews and tests spread all over the country in a representative sample of the population. Household survey, we did not invite people. We went to their house and then we invited them to take part. Low response rate. So, you know, a real life survey on how much COVID we had at that time. And as you see in the first round, it was pretty much concentrated in the north. Then it continued to be in the north and then in the northeast. And in the third round, we have north and northeast, and then Rio de Janeiro, for obvious reasons, as you know, the hubs for COVID in Brazil at that time. We are also doing the same, you know, keeping track of the proportion of the population with antibodies in our state in the south of Brazil. So our state, if you go, the southest you can go in Brazil is where we are. We did pretty much the same thing. We had 9 sentinel cities spread across the state. And within the state, we had 11 surveys from early April to 2020 to early April 2021. And when we started, and this is interesting to say, when we conducted this first survey, we had 2 positive cases in 4,500 interviews. We thought the test was wrong. But obviously, we were conducting the countrywide survey more or less at the same time. And in the north of Brazil, there were cities in which we would have one positive test out of every 5 we would do. So it was not the test. It was just that the epidemic did not arrive in our state before, mid-2020. And this is what we did. So within the first months of the pandemic, in the south of Brazil, the prevalence was very low. And then, unfortunately, in 2021, it increased considerably. And in April this year, we had as many as 20% of the population in our state with antibodies for COVID-19. We can discuss details about the tests and things like that, but I will just leave with this result. And I would just want to say that what a massive enterprise this was. So for the national study, I said 133 cities. I said 33,000 people in each round of data collection interviewed, but I should also say that we had 2,000 field workers. So, 2,000 is a big number if it is the sample size in most studies. In this study, 2,000 was the number of field workers. So it is a massive enterprise, and it was not easy to conduct. We published many papers using these data. One that I want to highlight here was a paper that we published showing that most people, in fact, had symptoms of COVID-19. So the idea that most infections were asymptomatic was not true in our data. It was true that most subjects did not need hospital care. They were fine, but they had symptoms. And one of the most important findings of our study was how important that symptom, loss of taste or smell, was, at least in our sample in Brazil. 6 out of every 10 people with antibodies had that feeling that symptom. So symptom that do not happen very often with other diseases, and that is very good at indicating that the person is highly likely to be infected with COVID-19. And at least when we go to places in Brazil, what they would do would be to track people's temperature and to check whether or not the person had a fever, which doesn't make much sense. The combination of symptoms is a much better screening tool, and I have to applaud, because when I got here in the US, I got the COVID symptom check from UCSD, and that is very good. It's not based on one symptom only, it's many symptoms, and that pretty much has not been done in Brazil, unfortunately. The other finding that we had in our sample in Brazil was that COVID, fortunately, the infections tend to be less aggressive, but COVIDs are just as likely as, adolescents and adults to be infected with COVID. This was true in all phases of the study. This specific result in the 3rd round was kind of weird. It's random variability. I would not say that kids are more likely to get infected. If you look at the big picture, all the surveys, it is the same likelihood as in the other ages. But then things started to become complicated when we presented these results. And I'm sorry that, there is something in Portuguese here, but Q1, which is dark blue here, represents the 20% poorest families in Brazil, and Q5 represents the 20% richest families in Brazil. So in every round of the national study, countrywide survey, although we know that COVID arrived in Brazil, as in pretty much every country, by plane from rich people, as soon as community transmission started to happen, we had the traditional inequality that we always see in Brazil. So poor people were twice more likely to have COVID than the better off. And this was true in every single step of the way. if we agree here that there is no, biological or genetic reason to have that finding, you would pretty much understand that this is social. Poor families live in smaller houses with more people living in the same environment. They have lower access to, the internet and to do things at home, and they have to leave the home much more often to feed their families. So, this is the traditional source of inequality we find in Brazil and in many other low and middle income countries, and in some high income countries too. But then we have this other result that was, you can see from the slide. I don't need to say anything. So I just need to say that green means indigenous populations, light blue and yellow mean Black populations and mixed or brown populations. Light green means Asian descendants, and dark blue means white people in Brazil. So this result was not received very well by the Ministry of Health, which, by the way, was the funder of this study. So then I will talk about a little bit more about the denialism part and the problems we are facing in Brazil, while I approach the last 10 to 15 minutes of my talk. So this result has not been received well by the Brazilian Ministry of Health. They were dealing with other issues related to indigenous populations, which include deforestation in the Amazon region and, land demarking and things like that. And they were not willing to have a result that COVID was hitting indigenous population more often than the other ethnic groups. So there was a press conference, and as the principal investigator of this study, I am the person who would give this press conference. It was in July last year, and the press conference took place at the Presidential Palace in Brazil, which is the equivalent to the White House in the US. So the press conference would be the Minister of Health and myself, and we would be presenting to the Brazilian population the results of this study that was funded by the Ministry of Health. Everything was all set. I sent the slides in advance. We had meetings. But when I was inside the palace getting ready to give the talk, as I was, 15 minutes before this talk, talking to Debbie and to Mike and to Rock, I was informed that this slide had been deleted from my presentation. I will repeat that. I was informed that one of the slides, this very slide from my presentation, had been deleted because the Ministry of Health would not want that data to be released. So it has been censored. That's the name of it. It has been censored from the press conference. And a few weeks afterwards, the Ministry of Health decided to stop funding this study. I'm just showing this Lancet Global Health article, which has nothing to do with our Brazilian study. This is a systematic review of serological studies on COVID worldwide. They reviewed about 500 studies, and our study in the south of Brazil was one of the few to have the highest score in terms of methodological quality. It's very difficult for the Brazilian government to say they stopped funding the study. They stopped funding the study for methodological reasons or for any scientific reason. It was clear that they did not like the result. And obviously, we did not accept the censorship. We published the result in the scientific literature. We had a story at the New York Times, and we had a story at the Brazilian main television channel about the ethnic or the race differences in COVID infection in Brazil, but they tried to censor the data. So then I stopped talking about our study, and then I will provide like an overview on what Brazil has been done to respond to the pandemic. What we say is that Brazil is committing 7 capital sins that explain the data that I will present soon after this on how Brazil has doing extremely bad in terms of responding to the pandemic. So the first thing that we learn in epidemiology is that when you have an infectious disease outbreak, one of the key things that you need to do is test, do contact tracing, and isolate suspicious cases. You know, that's the policy that South Korea, for example, adopted from day one. And it's no coincidence that they have mortality figures that are 50 times lower than the ones we have in Brazil. The other thing we know is that in a country like Brazil, and I will use US examples as well, if you want to fight to a pandemic, it's very good if you have a unified communication strategy, which would mean the scientists, the president, the other politicians, sports people, you know, music people. So every famous people saying pretty much the same thing. If that happens in a pandemic, it's more likely the population will understand the message. You know, it doesn't mean that we want everyone to think the same, but, you know, if everyone was advocating in favor of masks, for example, or in favor of the vaccine, for example, it would be much more likely that we would achieve a better result, better outcome. The other thing that I want to highlight, and this is important in epidemiology and public health, is that even people with very good intentions committed the mistake to try to respond to the pandemic with a clinical instead of an epidemiological approach. And that would be, you know, business people trying to provide hospitals with more oxygen or with more respirators or with more, you know, hospital beds in a way that in their minds there would be sufficient health care for every people or every person infected with SARS-CoV-2, which is nice from like a humanitarian perspective, but realistically, no health system in the world will cope with an infection if there is no action to stop the virus from replicating. And for, you know, you need to stop the transmission if you want to succeed. And many countries around the world have successful stories about it in COVID-19 that we will hear and that we hear and that we will continue to hear in the future. Vietnam, South Korea, Australia, New Zealand, and many others, Japan. So if you want to stop the pandemic, you need to stop the virus from transmitting. Pretty much that's as simple as that. You know, Brazil has suffered from lack of leadership. We have never had a crisis committee, for example. We had some anti-masks campaigns. So at some point I received messages in my WhatsApp that if I would use the mask too often, I could die from intoxication. I got that in my WhatsApp, and many Brazilians do. The other thing that Brazil has done a lot was promoting an effective treatment. It was providing people with an idea that, you know, don't worry too much. If you get infected, we have these miraculous. Oh, my English is very bad today. Sorry for that. I'm Brazilian, so I have an excuse, but it should be better. So we have these drugs that will save your life. And those were chloroquine or hydroxychloroquine and ivermectin. I know that you guys in the US heard about these drugs as well, but in Brazil, it was all over the place. So, and people did not die because they took these drugs. They died because they exposed themselves to the virus in the belief that if infected, they would be saved by these drugs. And unfortunately, these drugs proved not to save anyone. And the last thing Brazil has done has delayed purchasing vaccines. And this was a big issue in Brazil. For example, the Pfizer CEO testified in that Senate commission that Pfizer had 101 unanswered emails offering the Pfizer vaccine to Brazil in 2020. It's 101 emails. And you know, and we also had the anti-vaccine campaigns. They were not as successful as the ones you have here in the US, but they were there. And I think the most iconic things were, first, Sometime last year, our president said, you know, these vaccines are not safe. If you take one of these shots and you become an alligator, it's on your own risk. It's not our fault. We are advising that these are experimental vaccines. And now this last one, 3 weeks ago, and I mentioned it before, our president said in one of his weekly, lives or something like that, he said that the COVID vaccine was making people develop HIV/AIDS. So, you know, these things happened, and we are in 2021. Both myself and my group and other colleagues have estimated the impact of the vaccine delay. So not the impact of the vaccination in total, just how many deaths would be averted if we would purchase the vaccines at an earlier stage in Brazil. And I came out with 95,000 deaths, and other colleagues had a different number, 150,000 deaths, but it is pretty justifiable because they did it a little bit later than I did, and they did it in a more comprehensive way because they had more information. So pretty much we can say that even in the most conservative calculation, which is the one my group did, 100,000 Brazilians died because we decided not to purchase the vaccines very early on. Then just some numbers for comparison, and this slide is in Portuguese. I just want to share our language as well, but it's pretty easy to understand. So Brazil has 2.7% of the world's population, and Brazil has 12.5% of all COVID deaths in the world. It's very difficult to explain that. So another way to look at the same thing, the global COVID mortality, COVID mortality everywhere in the globe. If we look at worldwide data, excluding Brazil, out of every million people in the world, 550 died due to COVID-19. In Brazil, it is 2,800. It's 5 times more. And then what happens when we present this data is that people will say, oh, this is too simple. This is not how you should compare rates. You need to take other factors into account. And it's true. You can take into account the age structure of the population. The difference gets wider. You can compare Brazil with the other very populous countries in the world. And this is, the 10 most populous countries in the world. Brazil is the worst. Then you have Mexico, the United States, and Russia. And then you have 6 out of the 10 with very low COVID mortality. So it's not because we have many people that we have these tragic numbers. Then you can compare Brazil with the other BRICS, and we are there again on the top of the list. So what I said some days ago, that the only time in the history that you saw Brazil performing, ranking first all the time was in soccer, but not nowadays, some years ago. We were the best country in the world in soccer. Unfortunately, we are not that good anymore, but I will not talk about that. But we are definitely, one of the champions of the world in terms of mishandling of the pandemic. And the last thing I will show, so I'm moving towards the end, I have 2 more minutes only, is that, correlation is not the same thing as causation. Most scientists know that. And in 1965, Sir Austin Bradford Hill published a seminal paper about how to, check whether an association is causal or not. And he proposed 9 criteria to use. And, the most difficult one to be filled is specificity. That exposure will lead to that specific disease. Even for smoking and lung cancer, for example, you meet 8 out of 9 because, smoking doesn't cause lung cancer only. But we tried to find a way to test the Hill's criteria against COVID mortality. And the way we decided was the best way to do that was this. So let's focus on this side of the graph only. This is COVID mortality. So the size of the bar is COVID mortality. And the 5 groups here are Brazilian cities divided by the share of votes they gave for our current president in the last presidential election. So, you know, in cities which voted only less than 20% for our president, the mortality is in between 100 and 150. In the cities that voted a lot for this president, the mortality is above 300 for 100,000 people. So when you look at this data, the first thing you think, you know, this is the example of a correlation which is not causal. So why would you see an association between share of votes for a candidate and COVID mortality? So, and I know that here in the US, there are many studies showing similar things. And we decided to test whether this was causal or was just a coincidence by plotting overall mortality, excluding COVID, in this side of the graph. And we got the flat line that we were expected to get. So there is no association between votes for Bolsonaro and overall mortality, but there is a clear dose response association between share of votes for Bolsonaro and, you know, COVID mortality. And that talks a lot about causality, because it is for COVID that he will say the vaccine will cause AIDS. It is for COVID that he will say do not use a mask. It is for COVID that he will say lockdowns do not work. It is for COVID that he will say just take these drugs and you'll be fine. So I hope someone in the audience will have an alternative explanation, but I see that as evidence of causation. You know, in summary, Brazil is one of the worst countries in the world in the response to COVID-19, and there is no reason other than scientific denialism to explain that. Brazil has been really good in other things in public health in the past. HIV/AIDS, vaccination campaigns, Brazil has been pretty good on that. And the other thing is that aiming herd immunity, which was the goal of the Brazilian government at the very beginning, was the wrong strategy at first. But you know, Sweden, the UK had done the same wrong choice at the very beginning of the pandemic. But when data showed that herd immunity was a terrible choice, Sweden and the UK and the other few countries that were doing that, they changed, and Brazil has never changed. So it is just unacceptable, and it's not a coincidence that many Brazilians died, and you saw the mortality figures in Brazil as compared to the rest of the world. And you know, one of the basic principles of science or public health is that deaths and cases do not occur by chance. There is an explanation for that, and unfortunately, you can imagine what it is. So this is, you know, some of the publications that we did from this study. So, you know, Nature Medicine, The Lancet Global Health, American Journal of Public Health. So this is a project that has achieved a lot in science. And with that, I just thank you everyone for being here. And I hope to take questions. And it was my pleasure. Thank you, Mike. Thank you, Debbie. Thank you, Ron.
Thanks, Pedro, for a fascinating presentation. And yes, let's open up for questions. If you have questions or comments, please put them in the Q&A box. I'll open that up. I don't see anything there yet, but feel free to jump in. And while we're waiting, apparently in Brazil, the most contentious piece of information which you were presenting was the very high rates in the indigenous population. And are there explanations aside from the economic differences that you also showed for those very high mortality rates in the indigenous population.
Yeah, Mike. So we tested that a lot, because that result was, it is there. So, and pretty much it is a combination of social factors, as we would imagine, economic factors, but then cultural factors. Indigenous populations, and maybe we should learn from them, they tend to live more in communities, as more in groups than we tend to do. We have more like an individual lifestyle, and they have more a collective or a community lifestyle. And in that sense, this community lifestyle is good for many things, but for COVID, it was not that good, particularly for a disease that many people transmit when they are still at the early stages and they don't know they are infected. So that is the most likely explanation. And there is one more thing that is important. Indigenous populations tend to use a means of transport that is very common in the north region of Brazil towards the Amazon River, which are some boats. And these boats are packed with people. And at the very early stages of the pandemic, there is evidence that these trips helped disseminate the virus a lot, and that, was more severe to indigenous populations just because they use that mode of transport more often.
Okay, thanks. Okay, so we've got a couple of questions in the Q&A box. We'll start with Jair Siqueira Neto. What's the current situation in Brazil today compared to June of 2021? And if the president is still the same, can we attribute lower numbers of active infection today to vaccination only?
This is a great question, Jair. The first thing is that it is, every single country in the world saw that decline in the numbers due to the vaccination. So it is the vaccination, the main thing. But most countries had another spike when the Delta variant arrived. And in Brazil, it didn't happen. If you follow my, approaches to the media on that, from day one, I said, this will be a fight between the vaccine and the variant. And I'm not assuming that Brazil will have the same spike as other countries, because it is the vaccine, but it is also the proportion of the population that had already been exposed. So Brazil is better now because of the vaccine. And the other reason why Brazil is better now is not a good one. It's just because we had so many people infected before that we have fewer people to be infected. So I think it's the combination of the two things. And the one thing that is really good about Brazil is that the anti-vax movements in Brazil, they did not do well. So if there is a battle we won in Brazil, is the vaccine one. So over 95% of the Brazilian population wants to get vaccinated. And as of last week, Brazil has overtaken the US in terms of proportion of the population vaccinated, because pretty much we were very slow to start, but most people want to get the shot. So as soon as we have enough vaccines, we will have 90% of the population vaccinated, and this will help us, move away from the pandemic.
Okay, so the second question that you've started to address, and that's, you see a different horizon with the Delta wave for next year, and are the political decisions better than last year?
No, I don't think the political decisions are any better. The only thing I see is that I do see a different horizon, and I think 2022 will not be COVID-free in Brazil, but COVID will be much less of a problem because of the vaccination and because of the booster. So I think that even though I do not expect, the political situation to improve, I do expect COVID to improve. And, that's not in Brazil only, that's in most countries around the globe. So I think that we are much closer to an end than to the beginning of this pandemic. We need, it's always difficult to share good news in this period of time because people are afraid to share good news and then prove wrong. But I think 2022 will be much better than 2021. And, I don't expect that we ever get to the stage of thousands of deaths per day again in Brazil.
Okay. So again, I'm going to come back to the question about, well, let's throw this one out. I'll do questions for you. So one question is, what did the Brazilian government gain from misleading and misinforming its people? It seems inexplicable in a way, but
no,
yeah, thoughts on that.
They gain what they need. They gain attention. So I don't know why the person attending doesn't want to share his or her name, but it doesn't matter. They gain attention because there are many studies showing that if you go live and say that the COVID vaccine will cause HIV, you will get much more engagement than if you go there and say that the COVID vaccine will help, reduce the number of cases or the number of deaths, and for a government that needs this publicity because they have nothing good to show, this is what they do. They create new facts every single day because it's the way they will be in the media every single day. And it's no coincidence that they are now charged for 9 crimes. And if, the vote is for guilty, the Brazilian president can go to prison for as long as, 50 years. So it's very difficult to explain why they do that, but the only, logical reason is that they need this attention, and it's the only way they will get the attention.
And we have another question that's related to your thoughts about what's happening over this next year. And this question is specifically whether you think the third wave we're seeing in Europe will have this sort of impact in Brazil.
Yeah, no, I kind of answered that already. I think it won't. I'm not taking that for granted. It is impossible to have, that answer, and that's the one answer. Some colleagues disagree with me, but I think we will not get to that stage anymore. I think, the vaccine work. We know that we require boosters from time to time, but I don't see that the situation will get that bad again. So at least my scientific response, based on the knowledge we have now, is that we will not see in Brazil a third wave as bad as the one we saw before. And realistically, if you look at some data, even here in the US, when we had that, the last wave, it was first, it did not kill as many people as the previous ones, and 2, it was shorter in duration. So I think that is something that we will see. If we see the spike in Brazil, it will also be shorter than the previous waves that in Brazil they took for forever to be completed.
Okay, and Mirna has a follow-up question. What's your take on why we won the vaccine battle? As you said, even though we had so much incentive and publicity around not getting vaccinated in Brazil.
Changing people's behavior is not easy. We know that from my field, physical activity. People know that from the smoking field. People know that from the diet field. It takes more than just telling people what they should do to actually change behavior. The Brazilian population has vaccinated itself for many years now. The vaccinations for other diseases saved many lives in Brazil so far. So it will take much more than a denialist president to change the way the Brazilian population perceives vaccine. So, the anti-vax movement will have a hard time in Brazil because the vaccination history of the country has been so successful. So it will not be that huge.
Yeah, so we have another question on vaccine policy. What's your opinion about compulsory vaccination? And do you think this should be implemented in countries facing the worst challenges with COVID? And what do you think about exemption from vaccine given on presumably religious beliefs or other specific beliefs?
Yeah, so I think the question here is not about compulsory vaccination. It's about vaccine passport. I would not be in favor of compulsory vaccination. I would be in favor of vaccine passport. So if the person for any reason wants to, exert his or her freedom not to vaccinate, that's fine, if that person will not put others at risk. And the concept is exactly the same as smoking inside an airplane. You know, I could claim that I want to smoke in an airplane because I want to use my freedom to do that, but I can't, because I will invade other people's freedom, and they do not want to be exposed to, you know, the smoke from the cigarette inside the airplane. So it's the same thing, you know, and that has happened for years now. I don't know how many, but dozens of countries around the world. You will only get there if you have a vaccine against yellow fever, for example. And that is, you cannot use your freedom to put others at risk. And it's the same with COVID-19. So if the person will expose others, you know, the person should not do that. So if I want to do not to vaccinate, probably will not be able to go to an airplane. Probably I will not be able to be in the movies. I will certainly not be able to go to the baseball or to the American football match, because I will put others at risk. That's pretty much what I think about it.
Okay, great. Well, this has been a great set of questions and discussion. We're coming towards the end of our time. I want to remind people that this has been recorded and it will be posted on the fulbright.ucsd.edu site. And I want to thank Professor Hallal for sharing a fascinating presentation with us today. So thanks to everybody. Stay safe, take care, and we hope to see you again soon at another Fulbright presentation. So good evening, everybody.